Deep breath.
Hi, everyone, and welcome to the End of Life Journey and Beyond, the Sands of Time. My name is Lisa Strahs-Lorenc, and I'm a bereavement specialist. Hello, Susan. Nice to see you today.
Hi, Lisa, and welcome everybody. My name is Susan Capurso. I'm an end-of-life doula and legacy specialist, and we're here today to have a conversation about pancreatic cancer. And this is a deep subject. It's a touchy subject for any family member or anybody going through this ordeal, or if you've just gotten the diagnosis. Lisa has experienced this firsthand. I have not. So we just want to put that out there. And Lisa's going to tell us about quite a few things about the things she's learned along the way. So Lisa, why don't you start us off today? Thank you for touching on this subject that's close to your heart and your family.
Yeah, thank you. And of course, every story is different and every situation is different, whatever cancer it is. And so I want to talk about and share with you what happened to my husband in pancreatic cancer, and then go through a little bit about the disease itself and about some of the things not only have I learned, but things that are out there that certainly are helpful to know, etc. So in about 2007, my husband started having a lot of stomach problems. And we thought it was because he was nervous and, there were things going on at the law office and, he just was upset over things. But it was getting worse and he started complaining about back problems as well. So both those things had him coming home early from work often, and going to the doctor and them saying, you have some kind of gastroenterology thing, and maybe you have some stomach distress, stuff like that, and why don't you just calm down and you could take some Tums or all of that. And that went on for about 4 months like that. Um, and pancreatic cancer is really hard to diagnose just because of where it's located. It is behind the stomach and in front of the spine, and it's a very hard organ to find, which, by the way, I didn't even know what it was. Okay. So at about that 4 or 5 month time, my husband was just so sick that he went to the doctor, and the doctor said, this is a general physician, I think you have an abdominal blockage and I think you should go to the hospital. So we went to the hospital, and it was on the weekend, which is like the worst day to go. And before that, he had never had a CAT scan or an MRI or anything else. So they decided to do a CAT scan. It was very late at night. And I remember this resident coming in and saying to us, you have a growth on your pancreas. And number one, we looked at each other and said, I don't know where the pancreas is. And number two, what kind of growth? And so that was how it started. We checked out of that hospital because we wanted to go to a specialist and learn more. And so we started trying to find an oncologist and a specialist. Now, the thing is, he was in a lot of pain, and pancreatic cancer is painful, but sometimes undetectable until, it really moves along. So that's one of the problems with it, the early detection of it. And so the first thing he did was he went to we went to an oncologist, and all we did was complain about the pain that was involved, and we didn't know what else we were going to do next. And the oncologist, an older gentleman who I felt should really retire, just wrote out a prescription, didn't give any diagnosis, and wrote down oxycodone and MS-Contin, two really heavy painkillers, because that's how much pain my husband was in. And the DX on it said adenocarcinoma. Did not know that language. We went home. I filled the prescription. My husband, went upstairs, and I did research. And I looked up what adenocarcinoma was, and it said pancreatic cancer. That first wave of complete shock. Nobody had said it. Nobody had diagnosed or anything. And this oncologist never said it to us, but that's what he said.
Wow. Wow.
Such a shock. So I don't know what other people go through and whether they're told or how they're told. But yeah,
Did you
no
ever go
words.
back to him or say
No,
anything after the fact?
no, no, I was done with him, but I should have complained or something because no heart, no soul. I mean, really, yeah, and some oncologists are wonderful, but this guy was
Yeah.
obviously just not concerned or not, I don't know, didn't care, didn't care. So at that point, our theory was, okay, we'll just have it taken out. That's how little we knew. We'll just have it taken out. And so we went to 3 surgeons. My surgeon first, who was a general surgeon, who said to me, oh, it's in the middle of the pancreas. That's great. It isn't interfering with anything. I can just take it out. That's what he said. I knew nothing about how little he knew. Nothing. Okay. We got a second surgeon who is a liver and digestive, what is something or other surgeon. And he says to me, we really need to have this tested and see where you are with this. And the third surgeon said, he might be eligible for a Whipple, which is a redo of your whole digestive system and all. They take it out, they redo it. It's a big operation, but it's the best hope of really being free of any pancreatic cancer because it spreads. That's the problem with it. It really spreads fast. So, you try to do research, you try to learn as much as you can, you try to contact people. I went on a listserv immediately and I started reading a lot of what people were putting. This is a listserv of the world. So I saw treatments, I saw drugs, I saw Whipple, I saw a lot of things on it. And I was, just a listserv is like an email blast. And it's just a lot of people putting in my friend, my diagnosis. And I don't remember the name
Where
of
can
it.
people find this?
All
Where
I
can
did
you
was
find this?
I Googled pancreatic cancer listserv, and this came up as one of the largest pancreatic cancer listservs across the world. And as I said, they came from all over the world, so you saw different treatments in different places. So the next step was really the diagnosis itself. Now, here's the thing: there's this blood thing, and every tumor marks. It has like a protein or something in it. So the pancreatic cancer is a CA 19-9. That's the mark. That's the tumor mark. And so we did that, and he got 0. Now, most of the people with pancreatic cancer are in the thousands with that mark, thousands. And so the last person we saw who specialized in pancreatic cancer said, I think your tumor's benign. I think we're in good shape. This is what he said to us. We got very hopeful because 0 is wonderful. This tumor wasn't marking, it didn't have the protein, and we thought, wow, this is amazing. So now they do an ERCP where they put the person out and they put something down your throat, and because they have to see it. It's very hard to see the pancreas because, as I said, of where it's located. So they put the tube down and all that stuff. And after it's finished, the doctor comes over me and he says to me, I am so sorry. He said, this tumor is malignant. And he said, and I am shocked because most tumors mark. They have that protein. This tumor does not. Now, what I learned afterwards is 25% of tumors do not mark. They do not have that protein. And
That's a high
25%,
percentage,
high percentage. But
and he
nobody
should have
told me
known
that
that.
at the time.
Yeah,
It was like, I have a lot to learn. I have a lot to
yeah.
learn. So once the diagnosis was there and he told us it's in the middle of the pancreas, he told us that a Whipple would only be for a tail. That means the end of the tumor or the head, the beginning of the tumor. You can't operate in the middle of the pancreas. You can't do that. So all we
Not what
had,
the other surgeon told you.
that's right. That's right. Who was a general surgeon. And so there's going to be some really good advice here for everybody. Okay. Some really good advice. I worked with the Lustgarten Foundation, which is the world's largest not-for-profit organization right here on Long Island. And they have a lot of information, very helpful information. So let me just take you through where we went. So we went to a place that had a lot of pancreatic cancer cases, and he started with radiation, which was supposed to reduce the tumor. We did that for 6 weeks. He did pretty fine with that. And then we did chemo. And we did chemo for about 6 months. And what happened there is that the tumor went down altogether between both. It went down 80%. The goal was to get it small enough to be able to get rid of whatever was there. Now, at the time, we didn't know if it had spread or not. Once it spreads, all bets are off. So it had spread because apparently there was a small tumor by his liver. Okay. So where were we after these months? He felt better. He had lost weight in the beginning, 35 pounds. He started gaining some weight back. We had books like nutritional books, and we had other books to help us kind of get through it and the pain. He had 2 celiac nerve blocks. He, was on the pain pills and stuff. Here's the problem. He had no second line treatment. The problem is that beyond the first, what we call first treatment, which is your basic treatment, your basic basic chemo, okay? There are what we call cocktails. You can mix this, mix that, throw it all together, right? And the more you mix, the harder it is for the person to tolerate, because these chemos are all different types in your body. Everybody reacts differently. Every person is different. So I said to him, because I was his advocate, I said to him, why don't we try some specialty clinics and see what recommendations they have? Because at that point, Stony Brook didn't have any other recommendations. They didn't have any second line treatment for him. They said, we're done. And I said, how come we're done when he still has the tumor? So we went to Cancer Treatment Centers of America. There are 3 of them in the United States. They specialize in non-traditional treatments. We went through a week of testing of all kinds of, we had a team, we had a radiologist, an oncologist, a nutritionist, psychologist, an environmental something or other. I mean, we had a team of people. And at the end of that week, they come up with what they call their treatment, protocols. And they felt that he should have a clinical trial. For people to understand, a clinical trial is something that really hasn't been approved by the FDA yet. It's still being tested. A clinical trial 1 means that they do not know the dosage. They do not know the effectiveness. They're not sure about what the responses will be, etc. Clinical trial 1, clinical 2, they have tested a little bit. Clinical 3, obviously, the more you go up, the more they've tested. And by the time you're up to 4, you're in pretty good shape because they really have done a lot of testing and it's almost ready for FDA. Well, because my husband did so well on the first line treatment, he was not eligible for a clinical trial 3 or 4. They were offering him 1. And he said to me, I'm not going to be a guinea pig, meaning I don't want to try something like that. That was the end of that. Then I said to him, let's go one more place. And we went to Johns Hopkins, which is in Maryland. And they have a pancreatic cancer day. Only pancreatic cancer people come on this Tuesday. And I think it's like the 4th Tuesday of the month or whatever it is. And so we all went into the room. We were told we would be divided up into different teams. We were. And after now all the testing and everything else, same thing, clinical trial 1. We came back in September. And basically he said to me, that's it. I'm done. I'm done. And so we just went to an oncologist for palliative treatment, meaning keep him comfortable, so that he at least is not in pain and things like that. We went on a trip. We tried to do things that we had put off, and tried to keep him as comfortable as possible and not in pain. And he died in January. So I had learned a lot about pancreatic cancer. And after he died, I said, I really do need, for myself, I really do need to get some information out to people about this. So I decided to write a book, Pancreatic Cancer, It's a Family Affair. And I interviewed 20 families. And at the time, there were spouses and family members who were going through this. There were 4 of them. And at that time, all 4 were survivors. That was 2010. And they were doing okay. It's a very hard disease, but they were doing okay enough to live and to continue to do the best they could. By the time I wrote my second book, which was a follow-up, I wanted to find out after 10 years, where were we in our lives? Only 1 had survived, and she's already 12 years out. She had done very well. She did have the Whipple that I spoke about. She did have a few other situations, but medically she was able to stay on top of them, and she is alive. She's alive, and she's living her life. So tough disease, scary diagnosis, very scary. And you know, there's a lot of great suggestions about the disease.
That's what I was going to ask you. What would your top suggestions be for somebody who just received the diagnosis in their family or for
So,
themselves?
yeah.
Yeah.
So here's a checklist for newly diagnosed patients. And this is very accurate as I'm reading through it, especially, you know, for people who are trying to help their loved ones or people going through it themselves. Number one, understand the disease. So they stage the cancer, of course. You have to figure out where it has spread. You find out as much as you can, because that stage is going to impact, obviously, the treatment. There are different forms. There's two different forms of pancreatic cancer. Remember Ruth Bader Ginsburg? She did not have the one adenocarcinoma, so it didn't go as fast. She was able to live. Even Steve Jobs had it too, and he lived, you know, longer. I think he had a liver transplant, by the way, and that helped him through a few years, from what I remember. So that's very important. They also suggest genetic testing. They feel that that's important, just to find out what kind of, you know, if there's inherited kind of genetics and things like that. Any mutations, also any kinds of recommendations for your offspring. When we were at Johns Hopkins, I agreed to testing, genetic testing and stuff, us as a family, because my son and my daughter, you know, so there were other things as well for genetic
Is
testing.
that Lisa?
Yeah,
Is the genetic testing, Lisa? Is that's just blood work, right?
yeah, yeah, or
And
saliva.
they can tell that.
They
They can
can.
tell that. Okay.
Yes, they can. Then there's tumor testing. And that's, you know, early stages where you can really see whether there's genetic mutations, and other therapy programs might come out of that once you learn more about that tumor. Always, always, always seek opinions from experts. I know some people, you know, it's like me going to my surgeon that I knew. He was not an expert in this. He had really no clue. So we say at least two opinions. I like three, but you really need to go to large academic institutions that specialize in treating pancreatic cancer. They need to see this often. They can't just see some anomaly about this disease. Very, very important about that. And there's lists of those places. Your healthcare team, you got to know, and you have to have an interdisciplinary approach, like I was talking about, with other specialists, obviously your oncologist, but other people who will go through your overall care and who will stay with you. You need a treatment team, and you need the treatment team that you can trust. Okay, you got to trust them all. Contact the insurance company. You need to know what your insurance situation is, what's covered, out of pocket. We had very good insurance. We were really lucky. We didn't pay anything. We went to Cancer in America. They paid the whole thing. Same thing with Johns Hopkins. We're very, very lucky, but it's important to know. So this way you have a sense of what you're dealing with. You got to organize yourself. I had a whole book. I had a notebook and all kinds of things. I always kept questions in there, followed through on all my doctor's appointments, keeping track of test results. I kept all the reports and everything in one place. I kept DVDs and all that I could bring now to, you know, to other places. That very, very important to have all that information with you. Write down all the contact numbers of everybody, save it. You just have to, you know, be, you know, up to date. You got to develop a support system. Have someone accompany you to the oncology appointments. Don't be alone, because it's hard to remember everything, and other people will come up with other questions and other things that perhaps you didn't think of. That's how you can support your loved ones. Very, very important. I was really my husband's advocate. So important. He absolutely wanted to just bury himself in the sand. And, you know, that's his prerogative. He was going through the disease, but I wanted to find out what was going on, and I tried to help in whatever way I could. In the end, by the way, it was his decisions. If he had said to me, I don't want to go anywhere, I don't want to do anything, he's the patient, and that would have been his decision. We talked about it, and, you know, we came up with the plan, and this was part of the plan. But again, the support system is so important. Delegate responsibilities, get family members and friends and people to help with errands, help with chores, help with meals, help with driving, because there's so much and you feel so overwhelmed. So just don't feel you have to do this alone. That is so important. Controlling what you can. You got to monitor the nutrition. That's why I bought a special book called Treating Cancer, I think from Within or something. And it's, when he was nauseous, there's certain things I can give him. When he had diarrhea, there's other things I could give him. So that was very important. And obviously the physical activity, his pain level. I want to make sure he stayed out of pain as much as possible. I was not worried about him being addicted to these drugs. More important was he was in huge amounts of pain, and I need to keep him out of pain. So there are lots of other therapies like Reiki therapy, yoga, meditation, acupuncture. All those things really help, and even pets. Our pets stayed all over him, on top of him. The cats knew that he wasn't feeling well, and the dogs were just always by his side. And that's really helpful as well. And then the goals of the care, whether it's just keeping him comfortable, controlling the symptoms, a better quality of life, all of that. You have to have that treatment plan together, and then taking care of the emotional health. I know that some people who have cancer actually go on some antidepressants. And by the way, it changes your chemical makeup. So it's not just you're feeling depressed, but it actually changes your chemistry, your body chemistry. So don't think, oh, well, I'm crazy. No, these things are normal because they do happen in your body. So seek out counselors. Of course, he wasn't going to anybody. I did. I went to a cancer awareness group, and it was for caregivers. And so for me, I was able to speak to other people who had family members who had cancer, and we talked about helping our loved ones and what to do, and we talked about our own emotional health. He wasn't interested, but it's something that is important if they are willing to go. Okay.
Well, especially because you were partners, you were husband and wife. So, in order to be the best advocate that you can be, you needed that extra support system to help guide and support you through your journey as well.
And I think the other thing I want to say personally is the communication. You need to try and communicate as much as possible. At the end, when he said to me, I'm done, I've had enough, he needed to say that. I needed to understand what he wanted and respect what he wanted, because it's his life and it's his death. And so our decisions were made together. Obviously, it's his decision. But at the end, as I said, going places or seeing people, we saw a lot of friends at the end, kept him comfortable, decided to do hospice care at home. Now, I will say that, even though the disease is very scary and very frightening, there are people who live through it. As I said, my survivor in my book, I know somebody whose father had it, and he's 74, maybe. He's doing really well. He had the Whipple, and he's doing really well. Um, the one person in my book who isn't alive anymore, but who turned yellow because the tumor was by the bile duct, that's an early sign. If you get that early sign, you're really lucky. This doctor immediately said, you're turning yellow and you've got some problem, and sent him immediately to a surgeon. So he was really lucky to find something so soon. The problem is that the symptoms just, mimic many different things and may not be that particular diagnosis. I don't want to alarm anybody. Symptoms, listen, we all have stomach problems, back problems, and such. I don't want to have everybody think, they have pancreatic cancer and stuff. It's just that, with time, I mean, he lost 35 pounds pretty fast, and he was really sick, really, really sick. So beyond that, my two books, all the money has gone to Lustgarten. They work very closely with a leading lab out here. They are working on early detection. They're working on some kind of not a pill, but some kind of a blood thing. They're working on like a vaccine kind of thing. They're working on a few different things, and each walk that I go to, they update everyone of what's going on, and of course the survivors do their walk, and the rest of us, of course, remember our loved ones. So yeah, that's my story. And I'm going to get you to be pretty vigilant about raising money for this disease. So thank you for letting
Yeah,
me share.
of course, of course. Thank you for sharing that, Lisa. I know that it's hard. I also know that, it's powerful for you to be able to teach and educate on this subject, because you did go through all the details, but you were such a good researcher during this time, so you learned the ins and outs. But one of the key takeaways that I took from your story just now is the importance, and I didn't realize this either, but the importance of speaking to several different surgeons.
Yeah.
Okay, because they're not all educated the same, and they don't all know the same, and one could be a little bit more experienced in having worked with 10,000 patients versus the other who's worked with 500 patients.
That's right.
And you really have to trust your gut on certain things too.
You do.
Feel the way that they talk to you, listen to the words that are in between the lines.
Yeah.
And you really, really need to know, like, and trust your team, as you said. I think that's really important too, because it's not a time to play,
That's right. That's
and
right.
you need to be focused on all of these little details in order to give you the best choices, the best information. And you need to be your own advocate as far as um, doing research, doing research. And like this listserv, I never even knew about this. That was news to me. So important to find something like that, because not everybody's information might be, something you need to hear or listen to, or it doesn't affect you in some way. But then there may be that piece of information that will make you think out of the box and think twice about something that's either happening, or when it does happen,
Yes.
might make the light bulb go off and say, well, wait, whoa, I heard this before, and maybe we should try this or do it differently. And you're not going to be able to have those conversations with medical professionals unless you do some of the research. And that's why these books, all the books that you mentioned, are so important, whether it's food and nutrition and the alternative holistic therapies you can bring into your world. And the stories from the families, like you've written.
Yes.
You're an author, for goodness sake, on this subject. So you would have never, ever become an author on this subject in a million years
That's
if
true.
you didn't really get your feet wet while going through the journey.
That's
So,
true. And each of us had different experiences,
mm,
and and different the way things happened and all. We learned a lot, unfortunately. We learned a lot through this. I didn't know, by the way, that medical marijuana might have helped him. Just help him be more comfortable and help him with the nausea and help him tolerate food better and things like that. I didn't know that at all. And nobody even told us. Now I know,
well, I
but I
think
did.
that's a bigger subject nowadays than it
It
was
is
in
14 years ago.
2007.
Yeah,
I think you
14.
said, right?
Yeah, he died in 2009. Yeah, yeah. He lasted 15 months, which is more than some people do, by the way.
Yeah.
Outcomes for first 2 years is pretty slim.
And
So
in the reading
again,
I did, I kept reading that it's really the hardest thing to diagnose because it's
it is.
happening, and people, you know doctors aren't picking up it or can't pick up on it as quickly as with other things. um, and then I read a few things about some of the things you mentioned, about the signs, that there's not always signs,
That's
but then
right.
there are a few things, like you said. I remember reading about the abdominal pain and the skin, the yellowing of the skin, or maybe eyes, and then losing weight. I mean, that can mean lots of things
Things.
in
That's
one
right.
way.
That's right.
And dark colored urine, that could mean lots of things, different diagnosis. But one thing
Actually, I learned.
I read about were
Yeah,
blood clots. Did you experience any of that?
he had it late in the disease. Blood clots in
Okay.
his leg, and his legs were getting really. It was filling up with fluid. Actually, his abdominal cavity and his legs were filling up with fluid.
Okay.
Yeah, really tough. And the toughest thing for a loved one is to watch your loved one dying. Just it's there are no words. There are no words. You want to do everything you can, and sometimes you feel so very helpless. But me, the optimist, always thought, okay, I'm going to find something else. I'm going to research. I'm going to try something else. I'm going to do something else. I mean, that was my philosophy always. We're going to beat this
Right,
somehow.
right. And that's how
That's
I think about a lot of things as well. There's got to be an answer. There's got to be a solution that nobody knows about. Maybe we can do this. Maybe we could change
right.
that. And I think that as well. And then, if it doesn't work out, like your person in your book, who was a lucky one when it comes to
It
this
was.
disease, I believe,
She was.
you know, how do you, as a family member, Lisa, how do you finally accept that? That had to be really tough for you and your personality.
When you see finally, you hope, and we did something about hope in one of our videos, and you hope and hope, but at a certain point, you see that there's no more hope. And once that last time happened, and he was so sick, you realize that he needs to move on with his life
Yeah. You
because
know,
you don't want somebody suffering, okay? And you don't want somebody just withering in front of you. You just don't. And that's not how they want to live their life either.
that's right.
All right.
That's right.
Quality of life. We talk about that all the time and such. And that's why we had hospice at home, because he would be comfortable. He wouldn't be in a hospital. We'd be able to take care of him at home. People came in, social workers and nurses and dietitians and whatever. He only had hospice for a week. And they told me what was going to happen. They told me what was ahead. So at least I was prepared. And friends were visiting all the time, and they, brought
You
food and
stressed this earlier about communication, and that's why this is so important. This is whether you know the end result or not, whether you know the end of the diagnosis or not, that communication should go up a level now,
yeah,
because those open and honest conversations, doing things to be proactive just in case.
yeah,
These things
yes,
are important than saying nothing or pushing
that's
the
right.
conversation under the carpet and
That's right.
doing nothing,
That's right.
because it's just going to hurt everybody in the long run. I
Yes.
just thought of something else, Lisa, too. What's your thoughts on the person who's listening to this that does have that diagnosis, but maybe doesn't have a spouse, doesn't have family all around them, and they're saying, wow, listen to this. You're talking about being somebody's advocate and helping, but I have nobody in my
I
life.
I feel like everybody has at least a friend or somebody close. They don't even have to be a family member, because some people aren't close to their family members, but it's some kind of friend that they can trust. Most people have somebody in their lives that are their go-to person, and that's who you turn to now, because you
Also,
really you
also
shouldn't be doing
turn to
this
the
alone.
professionals and ask them for support. There's support groups that you can go
There are.
to yourself with the
There are.
diagnosis,
There
to
are.
meet other
Absolutely.
people and speak with other people, and to get
Absolutely.
that guidance and navigation and support along the journey,
Absolutely. Absolutely.
right?
And by the way, American Cancer Society has a listing of all their groups everywhere throughout the United States. So you can always call them up. Or again, the specialty like the Lustgarten Foundation, they have all kind of lists of support networks and things like that. So you're right. This way, you're not alone. But there's the emotional part too, of course. And somebody who knows them already, who feels something for them, a personal thing. That's important as well. I remember doing all kinds of things. One was I was told that La Bonne Vie, which is made out of the acai berry, ACAI. I don't know how to pronounce it. Acai
Achi,
berry
achi,
is
achi.
it's a strong antioxidant. So it's almost like a pyramid. I bought from someone who sells La Bonne Vie. It looks like a wine bottle. And it was strong and stuff, but they said that it was really good for him. So I had him drinking that. I also bought a book called Fighting Cancer from Within, and it had a CD in it that he listened to. And it's all about the mind body, about how you think about, the disease and all. You know, I was doing everything that
You
I
can
could.
do, you could do all of these all of these holistic things. It's wonderful. I advocate with my clients to try this, that, and everything because it's the fight of your life.
It is.
However, just know that everybody's journey is their journey.
That's right.
It is. And if this was the journey, I don't want to say that was meant to be because that sounds terrible. But it is their journey. And like you said, once your husband made that decision, you respected that because
That's
he
right.
fought the battle along the way, but you knew that it was ready to draw the line and you knew how to make that balance happen.
He had
This is
had it. He had had enough. And
yeah,
everybody, again, it's their decisions, it's their bodies, it's their lives. And he had had enough. He had fought
right.
enough. He had gone through enough. He
Yeah.
was done. It was done. And you have to respect that. And then you do everything that we've said, which is, see people who maybe you hadn't seen or go to a place that, you'd been talking about. Our last trip was to Rhode Island. We went to those beautiful homes. I love those homes. That's Newport, Rhode Island. And we stayed at
And
an
leave
inn
some of
and
your stories. Well, what about the legacy work we talk about all the
yes,
time?
absolutely.
That's
You do
really
legacy
important. And you
books.
can even journal, just journal.
Sure.
There's a starter kit that you can download off my website, susancapurso.com, and you can get started that way. But I wanted to make a point of you may be listening to this because you're on the internet all the time. But maybe if a person's suffering with their family member and they're not very computer savvy, let them know we can still be old school. You can still dial the number of the American Cancer Society. You can still make these phone calls to find
Yep.
these support groups and many
Yep.
other things. And libraries are really helpful for
Sure.
that as well,
Sure,
right?
absolutely. Absolutely. To me, it was the more you know, at least you're aware. And I think you can make decisions better
It
if you
helps you
do know
feel a
what's
little more in
going on.
control, right? You felt a little bit
Yes.
more independent and
Yes.
and in control. And that's the
Yes.
important part while you're going through this
Yes.
horrible,
Yes.
horrible disease. But I think we
Yes.
touched on a lot of good points today, Lisa.
Yeah, me
Did you
too.
think of anything else you want to share before we wrap this up today?
No, I do, from what I understand from Lustgarten, the research is really out there. There are what's called dream teams through Stand Up to Cancer. And that's an organization that was put together for all the different cancers. And what they do is instead of competing for the money, they put together these brilliant scientists and they make a team. Pancreatic cancer got $18 million just for
Wow.
research. So, they're doing things not as fast as we all need and want because, a lot of people. I mean, Ruth Bader Ginsburg and Alec Trebek, and Patrick Swayze. I mean, they all died of pancreatic cancer, and had diagnoses, and made them public so that people would know, which is
Right.
very brave of them,
Yeah,
So,
these videos that Lisa and I do are on a YouTube channel. YouTube is wonderful for this. So listen to videos. Again, trust your gut, and trust your own good judgment and feel good about the people that you listen to or the things that you want to try or implement into your situation. But YouTube is a wonderful, valuable learning tool.
yeah, and let me just
And
throw in that
yeah,
new therapies like immunotherapy and targeted therapies, these are all coming up and becoming much more popular with all
right.
cancers. And so again, if you find the place that has all these things and you're given choices, just ask lots of questions. That's it. Ask lots of
Okay,
questions.
well, thank you very much, Lisa, for getting so personal. That was
Thank you for letting
really
me
hard
share.
for you, but thoughtful and very helpful. So we appreciate you today.
Thank you.
And tell people what you do in your spare time, Lisa.
Well, first, let me mention the website that's on there because Families Move On has that second book. And again, that's 10 years after the first book was written. So the families are in there talking about their lives afterwards. So
Can
I
they find
also
the
like,
first book at
and the
that?
first book is on Amazon. It's on
Okay.
Amazon. And,
What's
but
the
they can
title of that?
contact me directly. They can contact me directly if they'd like,
For the
you
book.
know,
Okay.
yeah, for
Wonderful.
each book. Yeah. So I've been doing a support group for people, especially during the holidays, how difficult it is when we've lost our loved ones. And we've been talking in terms of how do you deal with the holidays? How do you still celebrate our loved ones? Not just forget that they existed. So important to bring in, as we've talked before, about the things that they enjoyed and the things that we can remember about them and pass those things on, which goes to you now in legacies. Go ahead.
So there are a few branches that I dive into. Take a look at my website and you'll see the few things I do, the doula work and the legacy work. But today I just wanted to mention something. At the moment, you can look on susancapurso.com and you'll see Creative Legacy Specialist certification. So I do have a certification program where I'm teaching other people to go out into the world and help others to leave their thumbprints in history and to help them leave their own legacy. So I'm
That's
helping
great.
people to get this certification, and you can do that through my website as well.
That's
And we
great. Wow,
appreciate you
nice.
stopping in today. Hard topic, but I think we covered a lot of good points for anybody going through this. And make sure you do your research, find the support out there that you need. And if you have any questions or concerns, always reach out to us and we'll
Yes,
be happy to talk with you over the phone. Right? Thank you
absolutely.
very much for
All right,
joining. And Lisa, I will see you next week.
we will. Take care of yourself.
Okay.
Okay, bye-bye.
Bye.